Diabetes is a serious global health challenge with a rising prevalence and substantial effect on disability and mortality worldwide. Despite medical advancements, gaps in the cascade of diabetes care comprising diagnosis, treatment, and glycemic management persist, hindering effective management. We aim to comprehensively assess the state of the diabetes cascade of care globally, identifying areas of strength and needs for improvement in diabetes management. Methods using data and methods from the Global Burden of Diseases, Injuries, and Risk Factors Study (GBD). This modeling analysis spanned the years 2000 to 2023 and covered 204 countries and territories. We systematically reviewed cross-sectional surveys that are representative of the general population and the published and gray literature to estimate the proportion of people with diabetes who are diagnosed but untreated, receiving treatment with suboptimal glycemic concentrations, and receiving treatment with optimal glycemic concentrations. Treatment was defined as current use of insulin or other hypoglycemic medication. We separately modeled these quantities by location, year, age, and sex using Dismedem R2.1, a hierarchical Bayesian meta-regression modeling tool. Then scaled the estimates so that they sum to 100% of people living with diabetes in each stratum. Using GBD 2023 estimates of the number of people with diabetes, we calculated the diabetes cascade of care, proportion of people diagnosed among those with diabetes, proportion of people receiving treatment among those with diagnosed diabetes, and proportion of people with optimal glycemic concentrations among those receiving treatment for diabetes across all strata. Findings: in 2023, an estimated 8% of people with diabetes aged 15 years and older were diagnosed with diabetes globally. The proportion of people with diagnosed diabetes who were on treatment was 91%, and the proportion of people on diabetes treatment with optimal glycemic concentrations was 41.6%. Among all people with diabetes, the proportion with optimal glycemic concentrations on treatment was 21% in 2023 globally. Substantial regional differences were observed, with the highest rates of diagnosis in high-income North America, the highest rates of treatment among those with diagnosed diabetes in high-income Asia-Pacific, and the highest rates of optimal glycemic concentrations among those receiving treatment for diabetes in southern Latin America. These findings highlight the urgent need for enhanced strategies and capacity building to improve the detection, treatment, and management of diabetes worldwide. Targeted interventions to bolster healthcare systems' capacity to effectively diagnose and manage diabetes could lead to better health outcomes and reduce the burden of this growing disease.